Hi, we will introduce our research study about heart failure hospitalization and mortality risk. Early assessment of heart failure risk using machine learning could prolong life with higher quality. However, the limited availability of large survival data hinders training and model generalization. We examine whether our models previously trained on a large dataset for heart failure hospitalization risk can be effectively transferred to predict mortality risk among heart failure patients and other groups. Our models were developed using more than 21,000 subjects followed for a maximum of 10 years for hospitalization with a primary discharge diagnosis of heart failure. Their inputs are 30-second single-lead ECGs and basic clinical data. We developed two main models, a feature-based model based on XGBoost, and a raw signal model based on ResNet and DeepHit. In this study, we used 3 datasets with different groups at risk of mortality. Music consists of 992 heart failure patients with multiple tests. We matched patients' clinical information and transformed the 3 orthogonal lead ECGs into the derived 12 leads. SaMi-Trop includes ECGs of 1631 patients from a prospective study of chronic Chagas cardiomyopathy. CODE-15% is a large dataset with ECGs of a more general population. In our first experiment, our models exhibit decent discrimination and calibration in the music dataset. Without training and limited information, the drop in performance compared to the music risk score is reasonable, but it is impressive that they can still perform well on this task. For CODE-15% and SaMi-Trop, our models predict mortality considerably better than a previous risk model based on ECG's age. As shown in Plot A, our models can discriminate between healthier individuals, early-stage HF patients, and those at risk of death. Besides, the average survival curves for cardiac deaths have slightly lower than those for non-cardiac deaths in music. In Plot C, our models predict lower average survival for patients with a worse left ventricular ejection fraction without any prior knowledge in training. However, the Kaplan-Meier curves in Plot D shows a potential bias towards heart failure with reduced ejection fraction. These preliminary results would lead to exploring more comprehensive models that involve, at the same time, HF hospitalization and mortality. Our models, implemented in wearable devices with the MyHeartScore app, would help early detection and management of heart failure. Thank you for your attention.